a big headline from just a few days ago. Healthcare fraud indictments, dozens of them, involving care providers, physicians, other folks in the medical industry, from the Rio Grande Valley across the nation. It was a huge crackdown on Medicare fraud. A U.S. attorney is saying that more than 240 people were arrested. Among the things that they're accused of, for example, submitting fraudulent claims. The government prosecutor brought up a figure of $700 million, for example, that these individuals were responsible for. $7 million of that came from healthcare fraud, kickback cases on the border, and resulted in the arrest of 16 people here in the Valley, from Brownsville to McAllen, even over to Laredo. Joining us on 710 KURV to help us put all of this in perspective a bit, Attorney Bill Dombi. He's also Vice President for Law, National Association for Home Care and Hospice. Bill, welcome to the show. Now, you heard the intro. When you heard of these indictments, Bill, what's the first thing that came to mind?
First thing that comes to mind is that it's about time. The concerns that come from these indictments have been around for a while, and we have been working very closely with government officials to try to target enforcement activities appropriately, to clean up the isolated incidents of fraud and abuse in the home health care community. We have a zero tolerance for that kind of behavior. It is offensive to everybody, and it particularly causes harm to Medicare beneficiaries and to the good upstanding providers of services that exist all across the country.
Medical services, medical industry, what was the number that they bandied about for some time? They're 1/6 of the U.S. economy. They said everyone has a role, a part, a business stake involved somehow in the medical industry. How does the government, with its tentacles now in everything dealing with the medical industry, how does the government initiate these types of investigations? Where do they start?
Well, it starts from usually one of two places. One, which is growing in terms of its impact and value, are whistleblowers, individuals who are on the inside who decide to express to the federal government and to the federal enforcement authorities that something's gone wrong and that action needs to be taken. And the other is been developing only in recent times, which is a real-time data analysis. Much of what has been uncovered comes by way of seeing anomalies, aberrancies in data. A new provider of services comes on the scene, and a year later, they're billing Medicare for $10 to $20 million worth of service. Those are red flags, which now the enforcement authorities are saying we need to investigate, because providers of services don't come from the ground up to a $20 million or larger operation overnight.
Who are the worst offenders in this industry?
In home health, it generally tends to be a new provider of services, someone with virtually no experience in the delivery of care, someone who comes in actually with a plan to steal, and their behaviors are as much in violation of fraud laws as you can believe, billing for patients that don't even exist, paying Medicare beneficiaries to utilize their Medicare number, paying recruiters to go door to door and pay them on a commission basis just to get the Medicare number and name of beneficiaries.
We're talking about the recent healthcare fraud indictments. It was a nationwide sweep, and yes, some people in the Valley, Deep South Texas, were part of that investigation, that sweep. Our guest right now on 710 KURV, Attorney Bill Dombi. He's also Vice President of Law, National Association for Home Care and Hospice. So in the end, who polices the police?
Well, in part, media like yourself, bringing out the truth in the matter. And when you look at the Valley, the Rio Grande Valley, there are dozens and dozens of upstanding, long-operating home health agencies who have been delivering high-quality care to the residents for 10, 20, 30 years. And if these indictments, if these investigations go haywire, and sometimes they do, that's a responsibility of a number of parties to bring that up. There is an Office of Inspector General at the Health and Human Services that can investigate Medicare contractors who've gone across the line, and That has happened actually in experiences directly in the Valley itself. There are home health agencies who have been subject to intensive audits, but those audits have been called into question in a variety of ways, from members of Congress to organizations such as mine, to media such as yourself, and also through the appeal system that individuals can access to challenge audit determinations. The matters that are occurring in the Valley now, this nationwide sweep, these are criminal compared to civil kinds of matters. The only way to really judge the validity of that action is to let it play out a bit. The history does tell us that when they trigger a criminal indictment, essentially they have got a very strong case. Many other individuals in the past have pled guilty in order to maybe reduce their sentence and the like. So there are police of the police, and you know they do a reasonably effective job. The courts and the judges are one of those as well. First thing to distinguish, though, is between a criminal and a civil kind of action, and these are criminal in nature.
Attorney Bill Dombi, our guest right now on 710 KURV, we're talking about the recent healthcare fraud indictments nationwide, and it did sweep some individuals in South Texas. Is it your opinion that this area is one of the worst in the country, or is that an unfair assessment on the medical side?
Oh, I would not say it's the worst. When you're looking at it, there are 13,000 home health agencies in the United States. There are over 2,700 in the state of Texas alone, and several hundred serve the whole Rio Grande area and surrounding counties and the like. And you're looking at a few individuals who've been brought into this mix. When you're looking at that, just from an analytical perspective, that is a very minor level of offensive activity. One or two out of hundreds means it is not a cesspool of fraud and abuse. I don't know how many others might exist. Let's assume that there are zero, in which case then we're looking at just a really tiny isolated amount, which is problematic for the good guys. I mean, all those good providers of health services in the Rio Grande Valley are now having with a smirched image of themselves with providers of services, with beneficiaries in the public eye, and that is absolutely unfair. I mean, the kind of conduct that's under investigation and indictment, it's obvious. People just directly stealing. When you bill for a patient that's not receiving any services, that stands out as pretty obvious. So whistleblowers should look for those kinds of things, billings that don't connect to the patients, payments to referral sources, cash right out of pocket into somebody else's hand to say, send us your patient referrals.
Bill, we will keep in touch. Thank you so much, Bill Dombi, attorney, joining us on 710 KURV.